Hello, my name is Les Cupp. I'm with the Arkansas Center for Health Improvement, and we are going to go through this overdose prevention training of trainers for emergency services. Again, the program is called NaloxHome. We have that Overcome Overdose, Take Home NaloxHome, NaloxHome, Save a Life. So this work is supported by grant funding from the Substance Abuse and Mental Health Services Administration to the Arkansas Department of Human Services, Division of Aging and Adult Behavioral Health Services. So myself, the curriculum planner or the trainer, neither one of us has ties to the entities mentioned in this training. So we are underneath the Division of Aging and Adult Behavioral Health Services. Our program is funded through the prevention side of that program. And this is a map that shows the regional providers map. So, you can pick out which region you're in by the counties. And then, we introduced this because we want to make sure that people are aware that the regional prevention representatives in the area do some of the following things. They work with the community to develop coalitions, to develop, address alcohol and drug related problems, about educational materials, about pretty much any kind of drug or alcohol related thing that's out there, refer people to treatment, do trainings about substance abuse. They do trainings, about risk, refusal skills. They work with coalitions and groups to develop drug-free activities in the communities, and they advocate for policy and law changes that reduce risk of substance abuse. So the objectives of this training and the purpose basically is to train participants how to help patients and their families respond to an opioid overdose. So participants, will be able to identify overdose signs and learn how to steps to administer Narcan, the intranasal naloxone. So basically, this is a training to make sure that you can relay this information to the individuals that receive naloxone from this program that we provide for you. So I just kind of have this there to kind of think about, as you view this, to think, about how many overdoses you see in the hospital where you work on average per month. So like in Arkansas, we have the statistics here that show, the amount of overdoses that we've had since 2017. And we see a rise from 2017 to 2018, and then a drop in 2019, where during that time is where the Arkansas and the State Prevention and Treatment and Recovery Unit actually along with the State Drug Director's Office, implemented a lot of programs to provide grant funded naloxone to like first responders. They went through and did train a lot of treatment centers, fire departments, rural volunteer fire departments, and several entities across state, which dropped our numbers in 2019. And then in 2020 and 2021, you can see the rise back up in the numbers because of the introduction of fentanyl across the nation and Arkansas as well, along with the pandemic, the COVID pandemic that hit our state and country during that time. So NaloxHome is a program, and what our program does is we provide free naloxone to emergency rooms in hospitals so that they have it to dispense at discharge to patients or caregivers of patients who have experienced an overdose or might be at high risk for an overdose. And we like to put a lot of emphasis on the high risk part because data shows that more than likely you're going to see more individuals that are at a high risk for an overdose than you see overdose patients in the emergency departments. So the program is also there to remove barriers to the naloxone access. That may be barriers, may be stuff like, payment. Somebody may not want to have to pay. They may have a copay with their insurance, or they may not have insurance that doesn't allow them to receive, they won't pick up the prescription because of that. So this program provides it free to the hospital so it can be discharged to the patient or the caregiver of that individual at discharge at free of cost to them. So the program that we have is the reason that it's needed, and we feel that in our state, is because despite considerable prevention, treatment, and harm reduction efforts, as you can see on the graph in the earlier slide, that our opioid overdose deaths are increasing dramatically due to pandemic and the available of synthetic opioids like fentanyl. So patients who have been treated in the ER for an overdose, those individuals are at a greater and a higher risk to have another overdose upon discharge. And then again, like patients who receive a prescription for the naloxone upon discharge often don't fill it due to the barriers that may be involved with that. So basically, if a hospital, the requirement for the hospital to participate in this program is that we've either reached out to the hospital or the hospital's reached out to us, and we have come into agreement, have a signed memorandum of agreement with the hospital, with our agency. And then, the hospital will assign a point of contact person that will receive the kits. Usually, it's shipped to the pharmacy, it's medicine. So usually that point of contact person is a person in the pharmacy. And then participate in a training that will prepare staff members to recognize patients who might be at a higher risk of overdose and enable them to educate patients. So, we want to make sure that the individuals that are receiving some type of education through this process. And then there's also a minimal weekly reporting tool that we have. It's a link that we have that's usually given to a point of contact person at the hospital, which has a brief, it's to keep up with the dispensations. So it has a brief questionnaire. It has the date range, do it once a week. So it's during a certain week, an age range, their race, was it given to an at-risk person? Was it given to an overdose person? Was it given to their patient, or was it given to the caregiver? So there's just a few questions in there that has to be asked. And basically what this does is, when that reporting tool, it helps us to replenish the stock. So as you report, whether you had dispensations or not, we are able to keep up with the amount that you were given at the beginning of the program compared to how many dispensations you have. So when you get to a certain point, we just have some more shipped to you, because we have it direct ship from the manufacturer to you from there. And that's how we keep track of that. So the patients can get access to the NaloxHome. Because I'll show you in a minute, I have a slide that has some of these posters and then our QR code that you can put out to show people that something like this is available, but they can, they can inform emergency room staff of concerns about possible overdose, ask to be trained to recognize this. If treatment is needed for opioid misuse, they can ask to speak to a peer specialist, and I will talk about here in a minute how to access that and how to find one in your area. And then, we want to, like I said, if the naloxone is used to save a life, we have a QR code that the individual we encourage individuals that use the naloxone to save a life, that they report that, and they can remain anonymous. So we just, like I said, that's something we have that we encourage individuals to do. So as I mentioned earlier about the introduction of fentanyl across our country, we like to kind of add this in our presentation to let everybody know how strong it is and how, potent it is, and that it's, the reason for a spike in overdoses across, in Arkansas and across the nation. So we have this little image next to the penny, the little white speck next to the penny represents 2 milligrams of fentanyl. And that is basically all it takes in order for someone, to cause dizziness, nausea, or other signs of an overdose, somebody coming in contact with the drug. So there you have, that the fentanyl is powerful. It's 80 to 100 times more potent than morphine. And then there's the introduction of the carfentanil, which is basically 10,000 times more potent than morphine and 100 times more potent than fentanyl. And There's not been very many cases of that, but there has been some reported in Arkansas. So drugs laced with fentanyl. So basically fentanyl is used in combination with several other drugs and completely disguised in pill form. So we have introduction to counterfeit pills across the country. So fentanyl-faced heroin is basically one of the reasons, worsening the national overdose crisis. I mean, drug dealers use it to cut their heroin, dilute it to maximize profits because fentanyl is so cheap to produce. So then you have, because of the strength and the duration of fentanyl, multiple doses of naloxone may be necessary over an extended period of time. So naloxone stays in the system for like 60 to 90 minutes, whereas a drug like a heroin will stay in there for 48 hours. So stuff like that makes the individual susceptible to another overdose without even ingesting additional drugs. So this slide represents the onset and duration of action. And we kind of put this in there to show, the need that might arise because of individual needing multiple doses of naloxone, or, making sure that after they receive or the naloxone is given to them and the opioid overdose is reversed, that they need to seek medical attention because you have like a fentanyl there that's staying in the system. That overdose, the red line represents an overdose, and whereas the blue line represents a therapeutic dose. So, and you've got naloxone at the very bottom, that 60 to 90 minute window, whereas like a fentanyl overdoses could stay in their system for up to 24 hours. So we want them to make sure you seek medical attention, or if, for say, the fentanyl or the naloxone wore off before they were able to seek medical attention, hopefully there's multiple doses more naloxone to give the individual. So we want to make sure that slide's there because it represents that. So this slide just kind of represents what naloxone does. It goes in to the opioid receptor and knocks the opioid out, reversing the effects of the overdose. So this allows, once that naloxone takes the place of the opioid in the opioid receptor on the brain, then the overdose is reversed and allows the individual to breathe again. But the opioid is still floating around up there, and once the naloxone wears off, the opioid would go back in. So that's why, that individual needs to seek medical attention after receiving the naloxone. So some risk factors that could occur that may cause an individual to have an overdose. I mean, overdoses are accidental, they're intentional. Sometimes they're caused by individuals mixing substances that include alcohol, benzodiazepines, or basically over-medicating due to the misunderstanding of the directions on whatever they may be taking. So also, if they take a break, don't use for a while, their tolerance level may lower, and then returning to a large dose would increase that risk. Being alone doesn't necessarily increase the risk, but it does mean that no one will be around to help them if something goes wrong. So also, people who buy drugs off of the street may come across a new dealer, get a new supply, that's different strength than what they've previously used. And for intravenous or IV drug users, someone else may be preparing the injection, which, they have no control over the dose that they take. So these are the signs of an opioid overdose. Individuals not moving, they breathe slowly or not at all. They could possibly be choking, making gurgling or snoring sounds when they breathe. Their skin feels cold and damp. Their pupils are small. Their lips and nails either turn like blue or gray, and they cannot be woken up. So in order to screen for the risk of an overdose, these would be some of those at-risk things that could be in place that would make an individual eligible to receive the naloxone from this program. Is, you could ask them, do they use more than one substance? that can include alcohol or benzodiazepine. If they've ever witnessed someone else overdose, that would be something, that would make them eligible to receive this program. Have they overdosed? What delivery method of opioids do they use, such as, pills or shots, like an intravenous, with the earlier, like I talked about, with the introduction of counterfeit pills across the country, we know somebody could buy something off the street and they don't know what they're getting. So have they used Suboxone or methadone? Opioids and benzodiazepines is definitely something that would include them in that. And a lot of hospitals in Arkansas are rural. So, how close do they live to a hospital or to medical care is something that could be included in there. If they live several miles from a hospital out in a rural area, and, they've got a prescription opioid, that would definitely include them in that. Have they recently been incarcerated or in treatment? That would go back to that stop in time and use, and that would lower their tolerance level. So training patients and family members. So we want to make this program where it doesn't interrupt the daily activity of the emergency department, the least amount as possible. So, to screen for the risk and severity of an overdose, and then, like reviewing the signs of an overdose using the patient education card, which I've got some pictures of the education card that we're going to show you in a minute. So, and then review steps of administration of Narcan. And then in Arkansas, we have an app. It's called the Narkansas app. It's a mobile app that has resources available for treatment, recovery resources, opioid overdose information. So, and then review the steps for reporting the use of Narcan. And then review outreach methods to seek treatment and encourage patients to seek help. So in the next few slides, we're going to go over all those a little bit more in detail. So this is the education card, and it shows the signs of the opioid overdose. It's the same pictures that you saw a little earlier. And then know the steps to use Narcan. So, check for signs of overdose, call 911, administer the Narcan, support the person's breathing, monitor response, give more Narcan doses if needed. So there's the images for that. So this is the other side of the card. And it has, the Narkansas app, and then report the use of Narcan use. So the QR code that's on the education card is actually will take them to a link where they can report that they use the Narcan. We encourage this, this is where they can put in there, it's a family or friend, remain anonymous. So we encourage this, it helps to keep data across the state to know how many lives are saved using NaloxHome through grant funded programs, or, just track numbers realistically to see where we stand across the country with other states. So the Narkansas app provides resources on how to use Narcan and where to find treatment and support. You can download it at the App Store or the Google Play. This is what the image over here shows what the app looks like when you open it up. It's got the treatment, the recovery, prevention resources. The Rescue Now button is what you can use to push, and it'll take you to open up another page that has links to audio instructions in English and Spanish on how to administer Narcan or Naloxone. So, and that's just like the, report the Narcan. That's the same QR code on the education card I talked about a minute ago. So peer recovery support specialist, that's the one where, encourage the individual to seek help or whatever. This is a peer recovery support specialist, someone who has been successful in the recovery process and can use that experience to help others experiencing similar situations. So to contact a peer recovery support specialist serving the area where the patient lives or where you are in the hospital, the county, please use the opioid dashboard at www.artakeback.org. So a peer recovery specialist is just not somebody that's in recovery. They have to verify, that they've had continuous recovery for 2 years. there's an application process. This program is through DHS. So they have a recovery unit at DHS, and there's an application process that the individual goes through, and they have to have a reference, and they do a little background check on them. And they have to at least have a high school diploma or a GED to qualify. So once they go through the application process, they're set up and scheduled to go through a week-long training where they learn about, how to utilize the resources that are in the state. They learn about boundaries, problem-solving skills, and basically some communication skills to help them talk to individuals, in a way that they use their lived experience. So the Arkansas Opioid Dashboard at the arkansastechback.org site, if you scroll down on the Arkansas Opioid Dashboard, and you scroll down, it'll come to a list, and it says Peer Recovery Specialist of Arkansas. And over to the right, there's a button over there, like a little tab, and you can, by search, and you can type in a county. So if you type in a county, and you hit enter, it'll pull up peer support specialists that serve the county where you're at. So this is a screenshot, and it has a few peer specialists listed there. But this is what the page looks like when you look it up and you find a peer specialist in that area. So, and if you have any more questions about that, I'll have a slide at the end that has my contact information on it, my email. So if you have any more questions or want to know more about the peer specialist program, just email me and ask questions, and I will send you all the information that I can regarding that. I can probably even see if there's any peer specialist in the area that you serve to help you hook up with those too. So this is another thing that we offer to you through our program. This is just a little screen image of a badge hanger. They're a little bit longer than a name tag badge, and they're about the same width, and they go on the back of this badge hanger. So, but this QR code will take you, if you scan this one, it takes you to the ACHI website, the NaloxHome site, that will tell you all about our program. It'll tell you, include a lot of the information that I've already provided to you in the slide presentation, along with a link to a couple of videos where we were able to interview some overdose survivors, a parent who lost a son to an overdose, and then an individual that actually was walking through the park, and he saved an individual's life by administering Narcan to them. And so we have two video links there. One of them is, it's the same individuals, but they talk about their overdose experience along with stigma related to addiction that they've experienced along the way as well. So I encourage you to scan that QR code and check out our site. We also have some posters. We have some small posters that I guess are the 11 by 9.5 little posters that we have, and then we have some full-size posters that you can put up in your waiting room or areas, bathrooms, wherever, that shows that you are participating in our program, and it has the NaloxHome QR code on it that takes you to our site so they can learn about the program, and maybe that would encourage them to ask so that they know that it's there. And we'll make sure that you have those when we start your program. So the nasal portion, naloxone, intranasal naloxone that we offer is Narcan. So Narcan is a drug that's used to reverse the effects of opioids. It's safe and effective. It has no risk of any kind of abuse. Basically, if it doesn't have any effect on any other, like the non-opioid overdoses, it doesn't have any effect. If the individual is not overdosing and you give them Narcan, it's not going to hurt them. It cannot get the individual high. It's intended for rescue use and not long-term treatment. That's why it's such a big deal to make sure that an individual that administers Narcan to somebody understands that that individual needs to seek medical attention. Side effects. So side effects of Narcan, myself, I have a lot of experience. A lot of my experiences in treatment, working in residential treatment and in detox units. So like I look at a lot of these, and what comes to my mind is, a lot of them are withdrawal symptoms, the nervous, restless, irritable, body aches, dizziness, weakness, diarrhea, stomach pain, nausea, fever, chills, goosebumps, sneezing or running nose in the absence of cold, vomiting makes placement in rescue position important. So, and then at the bottom, some individuals may become combative. Sometimes, they feel like that their high's been ruined when they were brought back through the effects of the drug that they took was reversed. So what do you do if you suspect an overdose? These are off of the education card. It's the same. Check for signs, call 911, administer Narcan, support their breathing, monitor the response. If no response, administer Narcan in the opposite nostril. So administer the Narcan. So the Narcan comes in a box. There's 2 doses in a box, and it's packaged in a blister pack. So in the blister pack, the individual just peel off the back of the blister pack and insert the Narcan into the individual's nostril. Push the plunger in. It's a single dose. So, just a continuous, put it all in there at once. And then, repeat if necessary or if needed. So, like any kind of medication or medicine that we have, we always like to make sure that, the storage is important. Keep it in a place that's easy to access. Do not expose to extreme temperatures. It says, it's recommended to keep it room temperature, store it in its original blister pack. Don't ever take it out of that package until it's actually needed. And of course, pay attention to the expiration date. So it does say do not expose to extreme temperatures, but on the back of the package, on the foil of the back of the blister pack, it says do not exceed temperatures exceeding 104 degrees. That's a pretty extreme temperature. I kind of like the recommendation of keeping it at room temperature to make sure that it stays effective. So Narcan access. So with our program, a patient or their caregiver, completing the training, which is, them reviewing and make sure they receive that education card that we provide. So, and that individual can receive up to 4 doses of Narcan, which is basically 2 boxes, because like earlier in the slide presentation, I shared that, the strength of fentanyl, it may take more than 1 or 2 doses to reverse the effects of an opioid overdose if an individual is overdosing and been using fentanyl. So they can receive up 2 boxes of Narcan through our program and an instructional card, which I know that on the dispensation tool that's reported weekly to us, one of the other questions on there is did they receive 1 or 2 boxes of Narcan? So, and an individual, needs additional Narcan, that can be obtained, basically under through a local pharmacy. Our state has a standing order which does not require a prescription. But again, that raises those barrier issues with cost and things like that. So I'd like to thank everyone for viewing this today. And remember that every unit of Narcan given is an opportunity to save a life in Arkansas. And if you need more information, here is a slide that has our program director's information, Pat Branning. I am the educator or peer support coordinator, and then Angela Lassiter is the administrative coordinator. A lot of times if you seek additional information or we provide you with education cards for the amount of Narcan that you receive in the beginning. And when you receive another shipment later on, Angela is usually the ones that will ship you out some additional education cards or any additional material that you may need. So, and that's all I have for today. Thank you.